we'll get started here in just a moment. Are we ready to go? I want to thank the sponsors of this amazing bill to help save people money on prescription drugs, which is a big part of total health care costs. I want to thank Representative Lynch, Representative McCormick, Senator Janal, Senator Coram, and all the advocates for their work on this. I mean, you know, it's just outrageous that in this day and age, Americans, including Coloradans, are paying 5 times as much, 8 times as much, 10 times as much for the exact same pill made in the exact same factory as people in other countries. And that is one of the reasons that American healthcare costs are so high. This bill makes an important change to our prescription drug importation program, which already allows importation of prescription drugs from Canada to allow us to import drugs from other countries other than Canada. That increases Colorado's negotiating leverage and being able to get the best deal for Coloradans. It also improves the return on investment that we've already made in the working on setting up the Canadian program. Those RFPs are out and we'll be back soon, but there's much greater opportunities to be able to expand that. I am going to be so proud in a few moments to sign SB 21-123, which will save Coloradans money on health care. Specifically, will help Coloradans save up to 75% on many life-saving prescription drugs that people need for their everyday health. I'm excited to turn it over to our head of the Office of Saving People Money on Healthcare, Colorado's Lieutenant Governor, Diane Primavera.
Well, thank you, Governor Polis. As the Director of the Office of Saving People Money on Healthcare, I am really excited to see this bill signed into law. And the Governor thanked the sponsors, but I would also like to thank the sponsors for their leadership on this important topic. For far too long, people have been making difficult choices in order to afford their medications. I remember when I worked at Healthcare Policy and Financing more than a decade ago, I heard oftentimes about people splitting doses in half, relying on expired prescriptions, not filling a prescription, or cutting back expenses on other necessities like groceries so that they could afford their prescription drugs. And these are the decisions that no Coloradoan should have to make, and they've been making them for way too long. The savings that will be realized from our prescription drug importation program as a result of this bill will help save our state money, and it will especially help consumers and employers access more affordable medications without compromising safety. Senate Bill 21-123 is an important piece of legislation that I'm really happy that the sponsors were able to pass and that I'm really happy to support. And now I'd like to turn it over to Director of Healthcare Policy and Financing, Kim Bimstead.
Thank you, Lieutenant Governor and Governor, for your bold leadership and driving us as the departments to save people money on health care. This is a meaningful legislation. The number one driver of rising health care costs is prescription drugs, and we need a lot of levers to address those drivers, and this is one outstanding lever. For those who have chronic conditions, whether you're talking about a thyroid condition or high blood pressure or cholesterol, so many of the drugs that people take, often for the rest of their life, this gives them incredible savings. Canada was more than 60%. This is more in the range of 75%. It opens up supply chains to bring more drugs into our state. It helps boost the cost on ROI for infrastructure that we're building. And just as important as we bring down healthcare costs, it helps us make drugs more affordable for those who have healthcare disparities because of that lack of affordability. So when you think of Pueblo, when Coloradans, or 1 in 10 Coloradans can't afford the drugs they're supposed to take, in Pueblo it's 1 in 5. So closing disparities in healthcare is really an important piece of this bill. So I want to also thank our bipartisan bill sponsors, and I want to thank our advocates, and I want to thank my staff at Healthcare Policy and Financing. Everybody working together. This is pioneering, and that's what Colorado does. And under our governor's leadership, this is what we do. We have to pave the way to do unique strategies and implement unique strategies and overcome barriers when they come before us to help bring meaningful legislation. And I want to thank all those that contributed to that and introduce for you Senator Janal.
Thank you all for being here today, and I wish this bill had been as easy as 1, 2, 3, but it's taken a couple of years to get to where it is. We started out with Canadian importation and got through that. But now we have a bill that's expanding that importation beyond Canada into European Union countries as well as Australia and others. And it is bipartisan. The last year it wasn't bipartisan, so I'm very proud to say that I think prescription drug savings is not a partisan issue. It goes across party lines, and it's extremely important for everyone. But this bill is going to enable importation of the same drugs that we're getting now from other countries and enable us to bring them into Colorado at a lower price, as you've heard from Governor and from Director Bemsteffer, at 75% less cost on the average than the prices that we're paying right now for prescription drugs. It also ensures compliance with the extensive drug safety regulatory framework. And again, that's something that we can be proud of, that we are very safety conscious as well as cost conscious. So thank you so much. And now I will introduce Senator Quorum. Thank you.
Thank you very much, and it's great to be here and an honor to be a part of this landmark legislation, I do believe. I think it's something that will be followed throughout the nation. It has been great to work with the governor's office, the lieutenant governor, all these incredible bill sponsors, and healthcare and policy and finance. So it's truly a game changer. I guess my only question is, I've been here 11 years, and why did it take this long? That's the question.
Representative McCormick. The new chair, Chair McCormick, as a freshman member, congratulations on being chair of the Ag and Rural Affairs Committee in the House.
Thank you so much. And thank you all for being here today. What I love about this bill is that Colorado has always been a leader, and with this bill we are being proactive versus reactive. We are ready for when the federal government opens up those market opportunities, and the fact that our population here in Colorado is one of the fastest growing as far as the percentage of seniors, and our seniors need this bill. And as a veterinarian that deals with a lot of pharmaceuticals myself, I also appreciate that this bill and this way that we're going to bring in these pharmaceuticals are completely safe. They are FDA-approved facilities. They are FDA-approved drugs, and we're getting the same drugs for a much lower cost. So I'm super proud to be here today. Thank you, Governor, for signing it today, and I will turn it over to my wonderful co-sponsor in the House, Representative Lynch.
Well, there's some good things about going last. All the good stuff's already been said, so I'll be brief. Thank you, Governor. We appreciate your leadership in this, and thank you guys for something that, as a new guy and as a guy that makes belt buckles for a living, I don't know a lot about medication. And so when this was brought to me, I said, well, is this not something we're already doing? This is a common sense, free market answer that has nothing to do with party. It has to do with doing what's right for the citizens of Colorado by reducing drug prices. So I couldn't be more excited to be part of this. It's still got a ways to go. We've got some work to do. We're relying on the federal government to step up, but we're ahead of them. And so excited that we can lead the way for the entire nation from this state right here in Colorado. So thank you very much. Appreciate it.
Great. And without further ado, let's sign the bill. If you want to join me around here, and we will make this official here, the law of Colorado. It's officially the law of Colorado.
Yes.
Representative and Lieutenant Governor. Congratulations. This is a really exciting bill, and we're saving people money on health care.
Thank you, sir.